medical expert some questions this morning. I know I am feeling the stress of the holiday to-do list. Leah is as well.
Everyone is. Yeah. There is a new reason to find a way to relax this holiday season, though, as new research shows heart attacks tend to spike on Christmas Eve. Here to talk about that with us is Dr. Mandira Mehra. Thanks for waking up early with us.
Hi, good morning.
Good morning.
I mean, I know that the holiday season is stressful, but heart attacks spiking on Christmas Eve, this was really surprising to me.
And not just by a little bit. We're talking about almost 40%.
Wow.
I mean, the actual number was 37, but almost 40%. And, you know, we talk about all the great things. We see the Hallmark movies. We all have our favorite trees under the present. So we always talk about the good things. But to be honest, this is a time of high stress. This is a time of excessive food, excessive alcohol, and of course family, which can be stress-inducing for some. So what this study looked at was over 200,000 people, and it was published in the BMJ, which is a very reputable journal. It was a Swedish study that looked at cardiac events and people that were admitted. And what they noticed is on certain holidays and certain days throughout the year, these heart attack rates or myocardial infarction rates rose. What is a heart attack? The basic principle is that your heart can't get enough oxygen. There's basically a blockage, and unless that oxygen flow is restored quickly, the heart muscle starts dying off. So of course, calling 911, seeking emergent care is the best thing that you can do. That being said, there's of course things that we should do, of course knowing this study. Reduce stress, which is easier said than done, but not eating in excess, of course limiting your alcohol intake, and any stress that's happening, really trying to deal with that in a healthy, happy way. So we want to of course keep people alive, maybe change this study and this dynamic. Of course, on Mondays, heart attacks were also shown to be higher, and Christmas Eve this year is on a Monday. So anything we can do to really reduce that number and reduce the stress is a great idea.
There's another study, Dr. Mehra, that parents might be paying a lot of attention to this morning, and that is about high schoolers and vaping. There's a new survey out that says an astronomically growing number of high schoolers are doing this, are using e-cigarettes and Juul products. What should we be concerned about with this, especially because it seems like other drugs are going down?
Exactly. Yeah. And we take a look at really the smoking epidemic, the nicotine epidemic that we talked about. And over the years, that has come down now. Of course, policymakers increasing prices, things like that. And the irony is not missed. The fact that this was a substance or a tool that was used to help adults wean off and hopefully stop smoking. What's happened now is a lot of these products have different flavors, and the claim is that they were marketed basically to young people. And so this is a forbidden thing, this is a cool thing, it's definitely a trending thing, but over the past 2 years we've seen an increase that is astronomical. Not only are high schoolers using it, but even middle schoolers are using it. The fear and the danger here is that this is nicotine and this is addictive, so we are dealing with a substance abuse problems. You know, there's just not a forum created for really addiction centers for kids. We have plenty of addiction centers for adults, but if you are a parent and you are noticing this, talking to your child and saying, this is not just flavoring. The problem is a lot of kids, a lot of teenagers aren't even aware of the negative consequences here. They think it's just flavoring, and they get that high, they get that rush off the nicotine, but not maybe realizing the consequences of it. At a young age, our prefrontal cortex is not even developed, and what consequences that nicotine having on really a developing mind. So anything we can do to stop this epidemic is important, and we don't have great tools. I mean, we have patches, we have gums, we always talk about the adult ways to deal with this, but now we're dealing with a teenage and middle school population, and these are kids that have never smoked before. So it's not that population that we're smoking and now we're weaning off. What we're dealing with is a population that's never smoked before, has never been exposed to these things, and is very vulnerable, of course, to teenage pressures. So we really need to, it's a public health crisis, it's a pediatrician crisis, a medical crisis. The problem is that nicotine can also lead to other health consequences down the road. So in that developing mind, are we increasing the mental health crisis, depression, anxiety, all those other things we always talk about? So maybe it's all connected.
Two really interesting studies with some concerning numbers.
Yeah.
All right, Dr. Mehra, thanks so much for joining us this morning.
Great to be here.
6-9